Hi everybody. So I'm talking about chapter 10, and it's about reproductive system, both male and female. So you guys can read these slides after the lecture. I recommend you to have a look at these slides before the lecture. It will help you understand the other parts of the lecture. So here is the anatomy of female reproductive system. So before I explain the anatomy of the reproductive system, I want to tell you something else. So you see this bone, this is called sacrum, and this is called the pubis. That's chapter 4. So this is a line here, okay? So something like this. And that is called, anything below this is called true pelvis. And anything above that is called the false pelvis. So as you can see, a majority of the organs in the reproductive system is located in the true pelvis. So I start from here, and from the ovaries, there is one on each side, a small size, and it has two different functions. One of the functions is to produce hormones, estrogen and progesterone. Those two hormones are important for reproductive function, so development of ovum, maintaining and progression of the pregnancy. Also, they are important for secondary sexual characteristics. So in female breast development, redistribution of adipose tissue or fat, and also growth of hair in the pubic area, in the axillary area, and development of the genitalia, inner and outer genitalia in females. So these are all important functions of female hormones. This organ that you see here, this is called uterine tube or fallopian tube, and that connects the ovaries to the uterus. Uterus is a single organ, and this is in the middle, in the midline area. It is very muscular, you can see that. The frontal part is called fundus. This whole area is called body, and the lower part that enters vagina, this is called cervix. It has a cavity, and this cavity is connected with the fallopian tube and also with the vagina. And this area of the cervix that you see, this is called cervical canal. Uterus is located above the urinary bladder and anterior to the rectum and superior to vagina. The function of the uterus is development of the fertilized ovum to an embryo and fetus, and also contraction during labor so the baby can be delivered. Below the uterus you have vagina. Vagina is very elastic. These are the walls of vagina, and this is the vaginal canal. So the function of vagina is to receive penis during sexual activity. Ejaculation happens around this area, so the sperm enters the cervix and then into the uterus cavity, and this goes all the way to the fallopian tube. Also important, vagina, the other functions are used as a birth canal, so the fetus can be delivered, and also the menstruation, the menstrual fluid is coming through the vagina. And speaking of the menstruation is usually epithelial tissue that they die, and also some blood vessels that they bleed, and that will be the content of menstruation, because those blood vessels, if there is no conception take place, and there is a constriction of those blood vessels, so there is not enough blood goes to the epithelial tissue, and the epithelial tissue die. In this area that you see, this is called vulva or external genitalia. It is made of clitoris, and clitoris is similar to penis. It's an erectile tissue and it's also very sensitive. It is attached to the pubic bone, and also there is labia minora and labia majora. So labia majora, hair grows here, and the labia majora uncovers the labia minora. There is also hymen. Hymen is located around here, and it's a thin membrane, and that will protect reproductive organs from entry of any kind of insects into or foreign bodies into vagina. Some women, the hymen is not perforated, so normally it should have a small opening. This is how the menstrual fluid is coming through that. But sometimes in some women, they don't have any opening, and then the menstrual fluid backs up, and they don't have any menstruation during puberty, and the fluid backs up, and it will cause a cyclic abdominal pain. So some doctors think, okay, that it's a delayed puberty, but actually there's a problem with the hymen. So they make an incision in the hymen and everything will be okay. Also, this is the pubic area that is made of adipose tissue, and hair grows in this area as well. Excuse me. So this is the section of the ovaries, as one on each side. You can see the ovaries attached to the uterus by the ovarian ligament here, and each ovary has a lot of follicles. There is around 400,000 follicles on each side, but most of them will never grow. These are called primordial follicles, but each month after puberty, one of them changes and it becomes the primary follicle, and then they mature and they become ovum, and finally after a couple of weeks they are released. So the ovum, when it's released, it is goes to the abdominal cavity. Actually, it does not go directly to the fallopian tube. I'll come back to this, but look at this. This is this area still remains after the ovum is released, and that becomes corpus luteum. So that is a yellowish. This looks yellowish under microscope. That's why it's called corpus luteum. So that's the wall of the follicle, and that produces estrogen and progesterone. And the progesterone is important in the early stages of pregnancy. After that, placenta will take over. And if no conception take place, then the corpus luteum become corpus albicans, and that looks whitish in color. So what happens to the ovum? Then these finger-like structures that you see, these are called fimbriae. This is part of the fallopian tube. It picks up the ovum, and then ovum travels like this and goes around here. And if there is intercourse took place, a sperm enters uterus and goes all the way, swims all the way here, and somewhere here the ovum and sperm they meet, and the conception take place. After that, after like 4 days or within 5 days, it will come back, and the fertilized ovum attaches to the wall of the uterus. So then the rest of the pregnancy. In this image, you can see different ligaments here. This is one is called suspensory ligament that attaches the fallopian tube to the wall of the pelvis. Wall of the pelvis is made of bones. And this is another one. So this is round ligament. It's also important for the attachment of the pelvic organs to the wall of the pelvis. I mentioned this before. This is ovarian ligament. And there is also one big one. This is called the broad ligament. So this is connecting different parts of the female organs, and that's connected with the wall of the pelvic cavity. And so the whole organs, the inner organs of a female reproductive system is suspended in the middle of the pelvis. Um, so this image that you see here, you can see fallopian tube. Inside the fallopian tube, and this is now the uterus there. The upper part is called fundus, the middle part is called the body, the lower part is called the cervix, and cervix is protruding into the vagina. And this is the cervical canal. So the uterus is made of the inner layer. The inner layer is made of epithelial tissue. This is called endometrium and is very, very vascular. And then is the second layer, that is called the myometrium. And during labor, it will contract, so the myometrium contracts, so the fetus can be delivered. And the outer layer, that's called the perimetrium, so it's made of epithelial tissue. You can also see the blood vessels that are supplying all the organs, and they are running very close to the uterus and fallopian tube and ovaries. So these blood vessels. And this area is called fornix. This is an opening of the cervix. So if ejaculation takes place around here, then the sperm can swim here, enter, and then it goes all the way to this part of the fallopian tube. And then they come back and attach somewhere here. The mammary gland or breasts are also part of the female reproductive system and provide nutrition or milk in the first few months of the baby's life. It contains a lot of adipose tissue or fat, but also the glands. So these glands are made of epithelial tissue and that produce milk during pregnancy. And these are the ducts, and that ducts are also made of epithelial tissue. And around 21 of them open around in this area. That's called nipple. Nipple is a darker color and is finger-like structure surrounded by the areola, which is also darker in color. Here you can see the the uterus, and it contains fetus. Before I explain the other parts, you can see two layers here. One, the outer layer, which is thicker around this area, that's called chorion, and the inner layer, that's called amnion. Hard to see it in this image. You have to higher magnification to see it. And they are protecting the fetus. And amnion is secreting a fluid that's called amniotic fluid, and the baby is floating in the amniotic fluid. The fetus floating. The fetus also connected to placenta through the umbilical cord. Umbilical cord contains arteries and veins, so that's carrying oxygen and nutrients. And placenta is very vascular and attached to the wall of the uterus. So all the nutrients are picked up from the mother and delivered to the baby, and then the waste products are delivered back. During the early stage of the pregnancy, so the conception is inside the true pelvis around this area, and then after 3 months, 1 centimeter increase in size of the abdomen. So up to age 38, the size of or the height of the abdomen increase, and then after 38 weeks, it goes down a little bit. And the head of the baby also is moving downward in the later part of the pregnancy. So initially, it's not like that. This is the different stages of the labor. So when the labor, which is normally when the uterus is expanded a lot, there is receptors inside the uterus, and that sends signals to the brain, and the brain is producing or releasing a hormone called oxytocin. And oxytocin is important for contraction of uterus. So roughly the fetus is there in the uterus for 40 weeks, and then once the time is appropriate, the hormone is released, and that causes contraction of uterus, and that is where the labor starts. So initially you have false labor, and during false labor, the contractions are short and they are irregular. But once the contraction lasts 45 seconds and it's every 3 minutes, that's active labor. So that's the time that the mother has to be in the hospital. They will do a vaginal examination and they look at the size of the cervix. So the cervix, if it is dilated around 10 centimeters, then that means that it's ready for delivery. And also the cervix will go away to the side, so you cannot feel the cervix. The head of the baby comes down. So the thing here important is the anatomy of a female pelvis. So the sacrum should be back, and also there is other bones called ischium, and also those bones should not be very close to each other, so it should be to the side. So if everything is okay, the mother has energy and can contract, and the head of the baby is down, that's called engagement, and then the delivery will take place. But if these bones are very close to each other, then even if the head of the baby comes down, the rest of the body cannot be delivered. And in that case, you need a C-section. During the first time that the mother is pregnant, this stage lasts 12 to 16 hours. Again, it varies from person to person. But after the first time vaginal delivery, the second time the mother is pregnant, it will not last that long, so it will be much faster, couple of hours on average. The second stage is the expulsion. So usually the head is coming down. That's called vertex. And the face is downward, and then the shoulders and the rest of the body is delivered. Sometimes the face is coming first, and sometimes the shoulder or the legs or buttock area comes first, and then you have to do some manipulation. Sometimes the abdomen is sideways, so it cannot be delivered. You have to make some movements of the fetus, and if you cannot do it, you have to do a C-section. After the expulsion, then you cut the umbilical cord, and then the placenta will be delivered by itself. It usually takes around 45 minutes. Then you look at the placenta and see if everything is okay or not. So if everything is okay, that's a good news. Sometimes parts of placenta attaches to the uterine cavity, and if you do not remove it, that become infected. That's called endometritis, and the person will have fever and abdominal pain. So after the delivery, the nurse always goes and look at the placenta to make sure all the parts of placenta is there. Okay, so some pregnancy terms. One is twins. So there's two types of twins. One is fraternal twins, and the other one is identical. In fraternal twins, two different ova are fertilized by two different sperms. So once an sperm enters the ovum, then ovum prevents entry of other sperms into the ovum. In identical twins, after fertilization, there is a splitting happens. So that's after, and they look very similar to each other. Multigravida means that the person has been pregnant 2 or more times. This does not mean that the person has a live children. It just means the person has been pregnant, which means that the person is not infertile. That's the good news. Multipara means that the mother has given to live birth, so the children may be alive too. So that's a little bit different, because some women are at higher risk of abortion. So a spontaneous abortion, the baby is aborted, and they cannot keep the pregnancy. That's why there is a difference there, that these two are different. One is the number of pregnancy, the other one is number of live births. Also, there is another term that I will come back to that later, and that's also related to this multipara and multigravida. Dystocia is an abnormal labor. It lasts for a longer period of time. It's very painful. It could be Bony abnormalities in the mother, or the mother may be tired, or could be some other conditions, and that's why the labor lasts for a long period of time, 20, 25, 30 hours. So that's why um, you have to do some intervention. Discharges, so one is called the leukorrhea, so this is a whitish discharges coming. It's not necessarily from pregnancy, so this is any type of female, not necessarily pregnant female can have that. And normally a clear white discharge is normal, but if it is smelly, or if that's with fever, is thick, then that is not normal. That could be a bacterial infection, or it could be a fungal infection. A metrorrhea is discharge. A discharge can be a pus, and pus, is coming from bacteria, so dead bacteria, white blood cells, or it can be from mucus. So most of them is not normal condition. Menorrhagia means that the person has a heavy menstruation, and the menstruation that lasts 7 days longer or longer, and it is very heavy. So you can ask the patient how many times she's taking a tampon or a pad, and based on that, you can guess if the person has menorrhagia. And usually this increased risk of iron deficiency anemia. So this is better to be treated. Sometimes the person may have underlying problems like clotting problems, or they may have hormonal problems or endometriosis. So there's different reasons for that. Metrorrhagia is in between the menstruation, so that's again not normal. It can be from hormones, or it can be from sometimes it can be cancer and clotting factor problems. Menometrorrhagia is combination of the two, is always abnormal. So again, bleeding problems like clotting factor or platelet problems. It could be endometriosis, cancer, things like that, polycystic ovaries, things like that may cause that. Preeclampsia and eclampsia, they are studied together. During pregnancies, a lot of estrogen. Estrogen causes the dilation of the smooth muscle, so there's a lot of fluid accumulates in the body, and that will cause hypervolemia and hypertension, a lot of fluid in the brain that will cause headache, and a lot of fluid in the between the tissue, and that cause swelling of the tissue, so this edema. If the condition continues, too much pressure in the brain, that will cause neuronal damage, and that can cause seizure and coma. So this is very, very serious. And another feature of eclampsia, you can look at the amount of protein in the urine. So the number of protein amount of protein increase, it means that the person is going into renal failure. So that's another issue with eclampsia. Abruptio placenta is a condition that the placenta ruptures, actually detaches, not ruptures, detaches from the side of the uterine wall, and that will cause bleeding. So that's an abnormal condition. It should not happen. And the other one is placenta previa, that placenta covers part or the whole cervical canal. So if it is covering the cervical canal, what does it mean? It means that baby cannot be delivered. Or if it is like this, it's very close to the cervical canal, it may cause severe bleeding. So if it is like this, it's totally covering it, you may need to do a C-section instead, because the baby cannot be delivered like that. Endometriosis is that the endometrial tissue, which is inside the uterus, grows in other parts. Like you can see in this image, in the rectum, in the abdominal cavity, in ovaries, in fallopian tube, in the vagina, in urinary bladder. So every time there's a hormones increase during normal menstrual cycle, then they get a lot of abdominal pain, cyclic abdominal pain, and they also have increased bleeding, so it's not normal. Plus, they are at higher risk of infertility. Inflammatory pelvic inflammatory disease is bacterial infection, and that will cause fibrosis of the fallopian tube. So that is an abnormal condition. It is common as a complication of sexually transmitted infections like chlamydia and gonorrhea. Sometimes women do not have any signs or symptoms, and they have the infection, and the infection will cause fibrosis of those areas. So with one episode of PID, a woman can have a 33% chance of infertility. With the second episode, 66%, and with the third episode, almost all women that had the 3 times PID will be infertile. So it's a really serious condition. Infertility is that when a woman and a man have sexual relationship for a year, for 12 months, and the woman wants to become pregnant, and pregnancy cannot take place after 12 months of unprotected sexual activity, and then you can say, okay, the person might be infertile, one of the two. So about 40% of cases are from men and 60% are from women. In this kind of situation, you have to have a sperm analysis. For a man, they want to see, I will talk about that later in the male reproductive system. And in the female, you can look at the hormones, and if there is abnormality you find, you can do an ultrasound and some other tests that you can do. Pseudocyesis is a condition that the person abdomen, the size of the abdomen is increased, but the person is not pregnant. So the person thinks she's pregnant, or psychologically she thinks she's pregnant, but she's not pregnant. So it can be physical or psychological, but there's no pregnancy. Stillbirth is that this is the one that I was talking about, multipara and multigravida, that the baby dies, or the fetus dies inside the mother's womb. So that can be before or at the time of delivery, and that is a major psychological shock for the mother. If it happens before the pregnancy, before the delivery, and the size of the fetus is small, you can give medication to absorb it, or you can do an abortion. So that's a couple of different options. Prolapsed uterus is the uterus is coming down through the vagina. See, this is a uterus normal, and this is coming through vagina. And in some cases, you can actually see the cervix outside of vagina. There are 4 different stages, and this is the 4th stage that you can see it from outside. So why a woman has that? Because you have muscles here normally, and it's called pelvic floor muscles. But during multiple normal deliveries, these muscles become weak, and when the person is like 60s or 70s, then these muscles become very weak and cannot support the uterus, and the uterus comes down. And you can see it compresses the urinary bladder, and that may also cause problem with urination. A toxic shock syndrome is bacterial infection is caused by staphylococcus. This happens in women that they forget their tampons. So they have menstruation, they put the tampon and they forget it, and then the bacteria grows there. And then the bacteria goes to the blood and can cause a high fever and chills, low blood pressure, and the person can go to shock. PMS, the cause is not very well known. It's related to hormones, and the person will be very irritable. They have headaches and stress and anxiety, and also the breasts are tender, and that happens before the start of menstruation. So this is like a cycle that happens every month. Fibrocystic disease, it's sometimes confused with breast cancer, but it's not a cancer. Happens between age of 35 to 50, and the woman feels masses in her breast, but that's not a cancer. There is also another condition, it's called fibroadenoma, and that happens in younger women up to age 25, and they may feel masses in their breast, and that's because of the hormones. If the masses you see that a person that has a family risk for breast cancer, that's then you have to investigate for breast cancer. So any mass should be investigated. But for at younger age, you should wait one menstrual cycle, and if it does not go away within 6 weeks, then you can do this. You can do more investigation. One of the diagnostic tests for women is called pap smear. So you can put a speculum into vagina, open vagina, and take a sample of the cervix, and then you put them under microscope and you examine for any kind of cancer cells, and that is as a screening test for cervical cancer. It is recommended for women between age of 21 and 65. If a woman is sexually active, they have to do it each year. But if it's a monogamous relationship and everything is normal, so that the interval between each test can increase. If a person is you're thinking the person may have cancer or they may have infertility or some other diseases, then a test you can do is called a stereosalpingography. So you put a catheter into vagina, then inject contrast in the uterus. You can see any masses or any congenital abnormalities in the uterus, and that contrast goes into the fallopian tube. Normally you should see that contrast is filling up the fallopian tube. If it does not do that, then it means that there is a blockage there, so that may be cause of infertility. These two tests, amniocentesis and chorionic villus sampling, is to detect genetic disorders, and usually happens between age of 12 weeks to 16 weeks of pregnancy, and it's more recommended for women above age 35, but any woman can do it. The thing is, the important ethical aspect of this test is these two tests are that whatever the fetus has a genetic or developmental disorder, will the parents are ready to have abortion or no? So if abortion is not an option, then doing these tests will increase risk of bleeding and infection for the mother, increase risk of trauma for the fetus, and also increase psychological stress for both parents. So you have to know in advance what you want to do before doing these two tests. After a baby is born, with the first minute and then again in 5 minutes, there is a few examinations that you do. These are called Apgar score, and each one is worth 2 points, so up to 10 points. So this is, you look at the color of the skin, that is for vascularization. It shouldn't be cyanotic. Should look at the heart rate and respiratory rate, and that should be normal. Look at the muscle tone, so that the muscle should contract, and also you touch the skin, and the baby should respond. So this is for, these two are for a neurological and muscle examination. So if everything is okay, that's good. If there is a decrease in the Apgar score, you do it again in 10 minutes. If it's really low, you have to do interventions. For example, you have to give oxygens, and you have to do some other stuff. So treatment and prevention, so both together. So like barrier contraception is not a treatment, unless for prevention of pregnancy. Condom is a common example, about 96% effective, but the condom should not be in a very warm place, like the person should not carry it around, or it should not be in the car. This is cause increased risk of rupture. And diaphragm is not very good because it prevents only 65% of pregnancies, and you have to use a spermaticide to kill the sperms together with it. So it's not advisable, not very good. IUD is a device that you put in the woman's uterus, and that prevents pregnancy, but the problem is it may cause pain, and it may cause bleeding, and sometimes fibrous forms around the device and that will cause infertility. So not very good option either. C-section is recommended for mothers that they cannot have normal delivery, or they choose to have that, and you make an incision in the lower part of the uterus horizontally, and then you remove the baby. Episiotomy is a procedure that's done at the later part of the labor, and you make an incision either in the midline or to the side of a vulva, and you cut the skin and also the mucous membrane. The reason for that is that if you don't do that, when the baby is delivered, this area may have rupture, and it will cause a lot of damage, and it will cause bleeding. It may even cause muscle damage and fecal incontinence. So it may go all the way to the anal area. So this is why most mothers go through this procedure. Is it painful? Oh, of course it is, but it's not as severe as the pain of the pregnancy. And what happens here that they inject anesthetics, and then they cut it, and after the delivery of the baby they can suture it, and usually it heals in 10 days. Hormone replacement therapy is for women that they go to menopause, or maybe they remove their ovaries because of a disease like a cyst or a tumor, or they may have ovarian failure, and that is to prevent osteoporosis, and they can also have their skin and other parts of the body in a better shape, because the organs that are responding to the hormones. The problem with this is that it may increase risk of endometrial cancer and breast cancer. So there's a big risk there. Oral contraceptive is probably one of the best options to prevent pregnancy. It's about 99.5% effective, but the woman has to take it all the time, and some of them has higher estrogen, and that higher estrogen increases risk of breast cancer and endometrial cancer. Oxytocin is a hormone, and that is given in the later part of the labor. So if the mother cannot produce strong contractions, she's tired, then you can give oxytocin, and that will increase risk of increase contraction of the uterus and decrease risk of prolonged labor. So this is the male part. So the reproductive system of the male, I started with the testes. Testes is located in the scrotum. The scrotum is a sac. So the reason for that, why the testes is located outside of the rest of the pelvis, is because the testes produce sperm, and sperm grows in a cooler temperature. So high temperature can kill the testes. The sperms. Testes also produce testosterone. Testosterone is important for the development of sperm and male secondary sexual characteristics like development of muscles and bones, but more importantly for growth of hair and coarsening of the voice, deepening of the voice, and growth of the male reproductive system. Once the sperm is produced in the testes, it goes to the epididymis. In this area, the sperm matures there during the later part of the sexual activity. When the ejaculation happens, these sperms go through this vast difference, this long duct. It goes all the way to here, the back of the urinary bladder, and they drain here in this duct. This is called ejaculatory duct. Another one here is there is another glands here that's called seminal vesicle, and this gland secretes nutrients, and that also secreted here in the ejaculatory duct. Another one is the prostate gland, and that also produces different nutrients, and that drains here in the prostatic urethra. So the semen contains the sperm itself. It's coming from the testes, and epididymis, it contains seminal vesicle fluid and also the prostatic fluid. Then that semen, it travels through the penile urethra and is ejaculated outside. The other part of the male reproductive system is penis, and it is made of erectile tissues. These are erectile tissue. So when the penis is flaccid, not a lot of blood is going there, but once there is an excitation, then the blood goes there and stays in the penis and fills up these cavities, and that will cause penile erection. This part of the penis is called the glans penis, and it is covered by a skin that's called foreskin. So not shown here properly, but that covers glans penis. So balanuria is discharge from glans penis. It's usually not normal. If this clear fluid that's happening before sexual activity, that's because of sexual excitation, that is normal, but other than that, it's not normal. Spermatolysis is a condition that the sperms are damaged when the sperms are released in the end of the vagina. That's called fornix, near the cervix of uterus. Then is antibodies in a woman is already formed, and then it will destroy all the sperms. I call that the ultimate rejection. This can cause infertility. A couple of abnormalities, congenital abnormalities in men. One is called epispadias, and the other one is called hypospadias. In epispadias, the opening of urethra is in the dorsum of the penis. So normally it should be on the tip of the glands, but this area is called dorsum. That's the dorsum of the penis. In hypospadias, which is much more common, it is in the ventral part of the penis. So you can see like this one. Look at this near the scrotum. So this will increase risk of infection and decrease fertility. So there is two risks there. In these patients, you should not do circumcision. You should not do the circumcision, and you can use that skin to cover this area, and you can create a normal urethral opening. Anorgasm means that the person does not have testes. Okay, there is no testes formed. And cryptorchism is there. The testes are there, but it is stuck somewhere. So normally during fetal period, the testes are in the pelvis, but they come down and they will be located in the scrotum. So when the baby is born, you have to do an examination of the scrotum, and the two testes should be there. If they are not there, then you may find it a mass there, or search through the different imaging studies in the abdomen. You have to remove the testes from the abdomen, and you have to replace it back to the scrotum. If you don't do it in the first 2 years, it will increase risk of cancer, and also infertility will be there. Hydrocele is accumulation of fluid around the testes, so the scrotum is enlarged, but there's no pain there, and that's usually a congenital abnormality. Varicocele is that the blood vessels around the testes is dilated, and that dilation of the blood vessel increase temperature, and that will cause infertility there. When you palpate it, there are swellings in the scrotum. They call it the bags of worm because the veins are dilated. It's probably the most common cause of the infertility in male, other than decreased sperm. Then is the testicular torsion. This happens in young boys up to age of 16. So the testes twist. So when the testes twist, and then the blood vessels around it, these are the blood vessels, also twist, and that will cause infarction, so that the testis dies, and it's very, very painful. So it has to be treated within 24 hours surgically, otherwise the testis will die. BPH is an enlargement of the prostate. So this happens in older men, and they have a higher risk if they have a family history and they have a higher testosterone level and things like that. So that will cause a problem with urination. That is a very common disease. Erectile dysfunction is called impotence. The person is not able to have erection. It can happen at a younger age. So if it is below age 40, that's usually from stress. And it can also be from other psychological reasons. For example, if they are raised in a very, very strict environment when they were young, and any kind of sexual activity was, you know, shown as something really bad. So that's why they have psychological issues, and they cannot get erection, or they may have interrelationship problems. So when they are with a partner, so they may not like the partner, so that happens, or sexual orientation problems. So they may not like the female, or probably the other way around. So they may have a orientation problem as well. So there's multiple reasons. But after age 40, the most common cause is vascular problems, so arteriosclerosis, hypertension, things like that, diabetes are the very common cause of erectile dysfunction. Priapism is just opposite of impotence, because here is the person has an erection and the erection does not go away. Usually this is not sexually related. It is underlying diseases like leukemia and sickle cell anemia. And you have to inject saline into the penis and remove the clot from the penis. So the procedure itself is very painful. These are the sexually transmitted infections. I put them in one slide. This does not mean that women do not get sexually transmitted infections. Somehow in your textbook, it is written in the male reproductive system, but either male or female can get that. So chlamydia is a bacterial infection, and in men it will cause discharge and a lot of dysuria, but in women will not cause, in most cases, will not cause any symptom. And that's why I said before that this may cause an PID and infertility, because they may not show anything. Genital herpes is like a vesicle that you can see these vesicles, so clear fluid, and that's a sexually transmitted infection, and that goes away and come back again and again and again. So it's painful vesicles. Genital warts, these are growth like a cauliflower around the penis, or it can be in the labia of a woman, and if it is not treated, it may increase risk of cancer. So it's a viral infection. Gonorrhea is usually the person gets a discharge, a yellow discharge, and both men and women, they will have a very high degree of dysuria, so they have a very painful urination. And syphilis is another sexually transmitted infection. They usually have a painful ulcer. This can be in penis or in the labia in a woman, and they have a raised border, reddish raised border, painless, and if it's not treated, it can go to the spinal cord and in the brain and in the joints and other places, so it can cause other problems as well. If you think the person is at risk of prostate cancer, then you can do a PSA. PSA is a screening test. You want to see if it is elevated above 10, is usually indicates prostate cancer. Prostate cancer usually does not show any sign and symptom until it is late. Sometimes if it is near the urethra, it may cause symptoms that are similar to BPH, but in other conditions it may not show a lot of signs and symptoms. Semen analysis is for a person that has infertility problem. So you can look at the number of sperm. So in each ejaculation is around 20 to 100 million sperm are released. So if the amount is very low, that can be a problem. Also look at the motility and the shape of the sperm. So it should be above 60% normal. Sometimes some sperms, they have more than one head, and if they have more than one head, that can also cause infertility. There is there is a lot of things that you can get information from semen analysis. So that's the first test that you do if a man comes with infertility problem. An oligospermia is a condition that the man has very few sperms. This is usually caused by hypogonadism. Nowadays there is a lot of chemical products, and those chemical products increase the amount of estrogen in a man, and the amount of sperms in the last 30-40 years has decreased in men. So that can be an issue later on also for other generations. Treatment castration means removal of the testes. It can be removed surgically, or it can be removed by chemicals like medications. Why? What can be reason can be cancer of the testes, or it can be cancer of the prostate or BPH and things like that. You want to reduce the amount of testosterone, so you can do that. Circumcision is that removing the prepuce or the foreskin. This is more a religious thing. So in some religions they recommend it, and some other religions they don't. I personally think it's a good thing, because men that are circumcised, they have a lower risk of penile cancer. They are also a lower risk of getting HIV. That doesn't mean it's a prevention for HIV, but it's a lower risk. Also, women that have a partner with circumcised penis, they are getting a lower risk of some of the sexually transmitted infection like HIV, and also they have a very low risk of cervical cancer, because the warts or HPV is less common in men that are circumcised. But that's a personal preference, I think. Transurethral resection of the prostate, it means the person has a cancer or the BPH. They put a catheter inside the urethra and they scoop the prostate gland out of it. So this is a non-invasive surgical treatment. Vasectomy is that they remove the vas deferens, and this is an easy treatment for couples. They want to control their fertility. Usually men don't like this idea. And vasovasotomy, if they want to go back, they can connect these two parts of the vas deferens, but it's not an easy thing to do. So they have to make a very good decision. They have to have children to do vasectomy, because it's not always reversible. Androgen therapy is for men who have oligospermia and hypogonadism. So it's not recommended for everybody. Some people are taking androgens to develop muscle. That's not a good idea, but because it increases risk of tumors in the liver, and also cause testicular atrophy. Antiprostatic agents that is for BPH, so that shrinks the size of the prostate gland, and then the person is able to urinate better. And a spermaticide is to kill the sperms, and that can be used as a prevention for pregnancy, but not very well recommended. Some condoms have spermaticides, and also if somebody is using a diaphragm, then they can use spermaticides. So you might ask, what is diaphragm? Is that it is a device that you put it you're inserted all the way up into the vagina and covers the cervix, so the person can have unprotected sexual activity without condom, and that way the sperm does not go from vagina to the cervix, but the problem is that some of them, they go there and it can cause pregnancy. So that's why they add a spermatocyte to kill those sperms. But there are other options, better options are there. So not a very good option. And that's it, guys.